two common types of prolapse and two devices that can help to reduce symptoms. We're looking at the kind of prolapses that are caused by weakness of the vaginal walls. This can be due to a family history, being overweight, pregnancies, vaginal deliveries, caesarean sections, constipation. Lots of different factors can cause women to have prolapse. It's a very common condition. We know that lifestyle changes and pelvic floor exercises can really help to reduce symptoms, and I'd advise that you read the blog called I Think I Have a Prolapse on the deSmit website for more information. So let's just have a little look at the basic anatomy first. If you imagine you're looking sideways at yourself, and I apologise for my drawing skills, but this is looking sideways. You have the bladder that sits nicely at the front, you have your uterus sitting behind that with the vagina, and you have the back passage behind, and the three entrances, the tube that you pass urine out of, your vagina and the anus. So we'll have a little look at weakness of the front vaginal wall first, and this is called the cystocele. And women who have a cystocele have weakness of the front vaginal wall. So the back passage comes straight down, we have the uterus and the vagina, and the bladder, instead of sitting upright and well supported, actually leans into the vaginal wall. So it doesn't break through, but it bulges and leans in. Now, there is a device that is called the Contrelle, and this device can help to give support to the bladder neck. So even women who don't necessarily have a prolapse but have weak pelvic floor muscles can benefit from this device. So the Contrelle very much fits in the vagina like a tampon. It needs to be saturated in water. It comes with a stick applicator, and what you would do is gently insert the Contrelle into the vagina, and in that position you can see how it would spring open and give the bladder neck the necessary support. And that device, when it's in place, can be held there for 16 hours. You can pass urine normally, and it comes with a starter pack, so you can work out which size is going to be of benefit for you. I suggest that you visit the deSmit website for more information about the Contrelle. So the second type of prolapse is weakness of the back vaginal wall. So just to have a little look at the anatomy again here, we have the bladder that sits at the front, we have the uterus and the vagina as it comes down, and we have the back passage, and instead of coming straight down, the back passage actually bulges into the vagina, and again it doesn't break through, but it leans into the back vaginal wall. Now, one of the common symptoms of a prolapse in this area is that the stool, when you have the stool sits in that weakened area. So again, we're looking at pelvic floor exercises, lifestyle changes, reducing the tendency towards constipation, so avoiding that by keeping your stool soft, the stool type 4, with diet and fluid. But if incomplete emptying continues to be a problem, some women resolve this problem by trying to support the area with the hands. Now, there is a device called the Femmeze that has been invented by a nurse consultant. Now, the Femmeze is a shoehorn shape with a paddle handle. It has two dents there at the end of the handle where you gently hold with your fingers. You use some aqua gel, some lubricating gel, and you can see how by very gently inserting the Femmeze into the vagina and by applying very gentle pressure on that back vaginal wall, you can see how the Femmeze will support the back vaginal wall, and it enables women to empty the bowels more effectively. Again, with both of these devices, I would suggest that you visit the deSmit website for further information, and again, just a reminder that they're usually used under the guidance of a healthcare professional.